Welcome back to my channel. In this video, I'm making a reminder video today to tell my patients and the audience that please do not sleep in your contacts. You have to take them off when you are going to bed. I know there are brands in the market, they say night and day, night and day, night and day, but still I do not recommend it because people still get infections, people still get complications, so be careful. So let's go over that. Why do I encourage my patients to take off their contacts before they go to sleep? Number one thing is, if they go in sleep or if they go to sleep with the contacts on, they end up with something called contact lens overwear keratitis. The second most common thing that I see in my patients who sleep with the contacts on, they get corneal ulcers, they get corneal scarring, they get contact lens scratching and crushing inside their eyes while they are sleeping. They get those complications. Let's go over those one by one. Number one is contact lens overwear keratitis. The layman terminology definition for that is it's the inflammation of your cornea due to the prolonged contact lens wear. What happens is this front part of the eye is called cornea, and if the lens is sitting on top of that for the whole night, it's not getting the oxygen supply. Your lens is depriving your cornea of its oxygen supply, and it's the ideal environment for the bacteria to grow. That's why you get inflammation of this thing called cornea, and the patient comes with redness, pain, blurry vision, sensitivity to the light, and that's because of reduced oxygen supply to the cornea, making bacterial contamination of the surface of your cornea. And the prevention is, please avoid sleeping in contacts and maintain proper hygiene. Look at the pictures here, look what can happen, okay? Next thing is corneal ulcers. People who sleep in their contacts, they come to me. When I examine their eyes under this thing called slit lamp, I find out that they have spots here, they have corneal ulcers there, as you can see in this picture here. Also, they get corneal ulcer. It's an open sore of the cornea, often due to the infection, and it comes with severe pain. Patient comes in pain, redness of the eye, discharge coming from the eye, blurriness. And there are types of infections, there are types of discharge. If you have questions, ask me in the comment section. I can elaborate in the answer section. Okay, bacterial, viral, fungal, parasitic. There are all types of bacterial, viral, parasitic, and fungal infections that can happen if you sleep with the contacts on. So please remove the lenses before you go to sleep and seek prompt medical attention, optometric attention for eye irritation, okay? Because you slept with it on. It means something is not right. Corneal scarring, another huge complication. I see patients who get scarring of their cornea and they can end up with corneal transplants. I have been referring them to the corneal transplants because they keep ignoring the fact that they cannot sleep in the contacts. I see them. It is not uncommon for me to find a non-compliant patient who end up with this kind of scarring. Thankfully, it's not common, but still, it is not uncommon for people to come with this kind of scarring. And once it's all white here, no light or almost no light gets in the back, and the patient says, I cannot see anything. So please don't get to that stage. You do not want huge surgeries in your eyes, okay? So scarring of the cornea is the permanent damage to the cornea leading to the vision impairment. Patient comes with blurry vision, pain, redness, sensitivity to the light, and in the late stages, patient has no pain. All he comes and says is, I cannot see, and it's been like that for so many years and months and so on and so forth. The cause is improper contact lens use and infections and injuries. It can happen to people who do not even wear contact lenses, especially if they got a trauma and it was not addressed on time. So it depends on the causes. If you have questions, please ask me in the comment section. The prevention is protection, care of the eye. Do not sleep with the contacts on. Avoid sleeping with them and treat the eye condition promptly. You cannot delay the things. And if the lens is crushed, the lens and its particles, they need to be dislodged. I literally have to flip their eyes, pick it piece by piece, piece by piece. I have to pick it up for the patients, and they're crying with the pain and there is pieces everywhere. I flip it, I go in the back. So please don't get to that stage because it's very painful. It comes with dryness, patient cannot see clearly, there is pressure sensation of the eyes, and the contact lens gets crushed at night because it has a pressure built in there. Pressure in the eyes during the sleep causes that, and the reduced oxygen supply makes it ideal for that to crush. Always remove the contacts. That's the best thing you can do about it. And please, the conclusion is, remember that there are risks associated with the sleeping in the contacts, and you know the importance of following the proper contact lens care guidelines. It's always given to you in the packet. Okay, I give it to my patients, I talk to them, I explain it to them, and encouragement to consult an eye care professionals for any concerns. Here are my references. Please ask me in the comment section. This is a very simple, straightforward layman terminology video. If you have specific questions, please ask me. I will make more videos in more depth in the future. Okay, thank you so much. Have a great day.